Are you comfortable in that position?
Yeah.
Can you bring your elbow up just a little more? Sorry.
Well,
Yeah, just like that. Is that uncomfortable?
not a bit.
Not a bit. Okay. Beautiful. So what we're going to do here, I'm going to go the most proximal place that I'm likely to go, which is right there. So don't move, don't move, don't move. Ouch. Sorry for the sting. Once again, blow just a little bit underneath the dermis, and then pause. Let the local anesthesia work so that it doesn't hurt when I move the needle around. Is that hurting at all there now?
Not a bit.
Okay. And then we're going to just stay parked right there because I know my needle is in a safe zone, and I'm slowly going to inject here. Is that hurting at all?
No.
And the whole idea is to be slow, be patient. So far I've put in about 3 or 4 cc's right there, and I haven't moved at all. Has that hurt at all? No. So now I can start moving my needle because I've got a safe zone to work in. And I'm going to re-aim it so that it's just below the dermis, and I'm going to blow slow before you go. That's the whole key. And we're continuing to use 0.5% with 1 in 200,000 lidocaine with epinephrine because we're doing both the elbow and the carpal tunnel. In this, it's worth pointing out again about the pH. The normal pH of lidocaine with epinephrine is 3.3 to 5.5. That's a range if you actually read the label on the bottle. If you add 1 cc of bicarbonate, 8.4%, which is only $4 a bottle and available in every hospital, you change the pH to 7.4. And of course that's 1,000 times less acidic than what the bottle is, which is why as I inject this, as long as I go slow, it's not hurting this gentleman. So now I'm going to go right here because I know that that should be a safe zone. He's going to tell me if it is. Did that hurt at all? Okay.
No.
So far, how are we doing up here in the elbow? The first poke, or did you feel any other pains?
No, that's the first little poke. I wasn't mad either.
Oh, that's good. And it shouldn't be bad because it's a 27 gauge needle.
Yeah.
So it's a pretty small needle. You know, it's
Sharp point.
a sharp point, pretty small needle. The big issue here is, or the big important point is big volume.
Yeah.
Big volume, lots of time, no rush, and blow slow before you go. I like to get at least 40 cc's up in the elbow, and so far I've put in about 10. And then another key, of course, is to give it time to work. And so we inject these patients well ahead of the surgery, and you can inject them on a stretcher outside of the main operating room if that's what you choose to do. We release the nerve. If the nerve was subluxating out cubital tunnel, in that circumstance I would go ahead and transpose it. I just tack a suture, do a subcutaneous transposition. So that's 20 cc's in the elbow so far. So we're going to put in the second 20. This is also 0.5% with 1 in 200,000 epinephrine. Did you feel that little needle?
No.
So far, just the first poke, right?
Yeah.
Can you extend your arm just a little bit more? Beautiful. Just to loosen up that skin right over the cubital tunnel. Another important point here is to just give the local time to work of the inflated local. I think you can pretty well see where I am. Always have at least 5 or 6 millimeters of local anesthesia ahead of the needle. In the old days when I just used to blast in local, as I was taught to do, people would always get pain 4 or 5 or 6 times, but just not necessary to have. So that's the end of it. That's 40 cc's of 0.5%, and I'd be happy to put in more if we needed to.